It's only 9 months since there were only 1 or 2 people in the entire world infected with what we now know as the COVID-19 virus. Now there are millions of cases and tens of thousands of virus samples which have been genetically analysed. That's allowed researchers such as Dr. James Hadfield to see how the COVID-19 virus has evolved and how it's arrived in Australia and New Zealand.
Yeah, there's been a really fantastic effort from the worldwide community here. So we currently have over 75,000 genomes which have been made publicly available for researchers like us to analyse.
So both Australia and New Zealand have imported hundreds of separate versions of the COVID-19 virus. We've been colonised, if you like, by returning Australians from overseas.
We have quite a lot of virus variation in the different countries in our area, which is a bit different to what we see in the United States and in Europe, where the viruses are much more similar. And I think what that's telling us is that in the United States, in Europe, the viruses came from just a couple of sources and then very quickly spread out in the various countries and communities.
Before the latest outbreaks in Victoria and New South Wales, the coronavirus was still circulating, albeit in small numbers. But the viruses we're now seeing in both states are different.
So what we're seeing now in New South Wales over the last 4 to 6 weeks or so is they're quite closely related to Victorian strains of coronavirus, and they are different, or a little bit different, from the viruses that were circulating before the second big outbreak in Victoria. So quite clearly, the viruses are mostly of, dare I say, Victorian or Melbourne origin.
Which leads us back to New Zealand.
Up until about a week ago, our analysis shows over 270 different importation events into New Zealand alone, most of which, or over half, did not result in any onward transmission.
For almost 4 months, there's been no community spread. But now there is. And these New Zealand cases seem to have originated from one, so far unknown, source.
What we have been really reassured by is that all of the sequencing data we have done of this new community spread are very tightly linked genetically. But what we can say is that it is not related to any of the managed quarantine cases which we have been sequencing over the past few months.
I think what's going on in New Zealand is clearly very interesting. If they're not coming from quarantine, then there's probably really only a couple of explanations. Either it's cryptic virus that's been circulating at an unrecognised level in New Zealand that suddenly re-emerged. It seems unlikely. So it's probably come in some way. People have talked about food preparation, frozen foods, those sorts of things.
What the experience of the last few weeks in New South Wales, Victoria and New Zealand has told us is that if our aim is zero community spread, we need to be prepared for surprises. And until a vaccine comes along, we won't be able to relax our guard with social distancing, use of masks, and we might need to consider the screening of food imports.
We probably are going to need surveillance around material that's imported into the country, particularly if it's coming in from countries where we know there's a high rate of transmission. Then probably we need some sort of molecular surveillance, if you like, to try and identify those cases before they spread to staff that might be working there and then into the community.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.